Now, October is the month set aside by advocacy groups to focus on breast cancer and raise awareness, support for research, and other efforts to fight the disease. Medical experts say breast cancer is affecting more and more women in Africa, and there is a need to step up awareness efforts. When 46-year-old Khadija Banwo found out she had a lump in her breast 5 years ago, she quickly booked a doctor's appointment. After several tests, she was diagnosed with a cancerous tumor and her doctors advised surgery.
God has been faithful to me. Emotionally and psychologically, I was not depressed at all. I've been a very hardened person. So I just felt my children are there. My husband was practically bedridden at that stage. So the two of us shouldn't go at the same time.
Breast cancer is one of the most common cancers in women worldwide. Factors such as age, obesity, inactivity, alcohol use, or early menstruation can increase the risk. While many women are often aware of breast cancer, some do not take steps to detect the disease in its early stage.
Early detection will save a lot of life, but not just, you can detect very early and you choose not to attend to it early. So for me, what I believe is no matter the stage you detect, be it stage 0, 1, 2, 3, be ready to address the situation properly.
The World Health Organization says more women are being diagnosed with breast cancer. Of 14.1 million new cancer cases reported in 2012, 1.7 million were breast cancer cases, an increase of about 20% since 2008. Observers say the majority of cancer cases are now occurring in the developing world, where effective treatment and detection remain a challenge. For Breast Cancer Awareness Month in October, residents in Lagos made an attempt to break a Guinness World Record by forming the largest human pink ribbon in the world. The current record stands at 6,700. They did not make the record, but still thousands showed up.
I came for this event because I've lost my aunt to cancer, and my mom is also a proud survivor of cancer.
I want to see a Nigeria where we phase out late detection of cancer totally. I want to see a Nigeria where more young people are driving research, are driving studies that will even generate drugs, medicine, chemotherapy made in Africa.
The International Agency for Research on Cancer predicts that by 2035, there will be more than 24 million new cases of cancer, with 13 million cancer deaths every year. Experts say half of the deaths can be avoided if there are concentrated efforts of cancer prevention. Joining us in the studio for more on the subject is Sylvia Dasi, Executive Assistant, a Research Associate and Community Outreach Specialist with the African Women's Cancer Awareness Association, AWCAA. Ms. Dasi, welcome to the program.
Thank you for having me.
So observers, experts say that more and more African women are being affected and infected, developing breast cancer. What is your observation in terms of African women here in the community that you work with?
Well, as you know, October is the month for breast cancer awareness, and our organization, African Women's Cancer Awareness Association, has been at the forefront in advocacy and also bringing awareness into the community, more especially on early detection, because early detection is the key to survival.
And early detection is indeed something we hear very often. What are we specifically talking about? We hear about self-breast exam. Tell us more about that.
Well, when it comes to self-breast examination, we are actually empowering the women to become an advocate of their own body, know their breasts very well, check out what are some of the signs and symptoms, for breast cancer, and that includes discharge from the nipple, bloody discharge that has pus. It also includes discoloration of the breast. It also includes disproportion of the breast when it comes to the size, as well as a lump in the breast.
Okay, when you talked about discoloration of the breast, what type of coloration are you referring to?
Well, everyone is familiar with their own skin tone. Yes. So if something is different from the norm, it should be something that should be addressed. And again, before I forget, also family history. Family history is something that is very important. You know, breast cancer is a disease that is also hereditary. So we talk to women to also look back in their family and see if anybody has been diagnosed with breast cancer.
Now, when it comes to the way it is being approached in the community, of course, women here in America, African women, may have more access to services and even organizations such as yours. When you look at the way it is addressed on the continent in Africa as an African woman, what can you tell us?
Well, as an African woman, our organization has been privileged to conduct medical mission where we extend our services beyond the boundaries of the United States and also in the continent of Africa. And by doing so, we are also contributing in the global fight against cancer. So when we go to African countries for medical missions, we understand that these are areas where the resources are very low as compared to here in the Western world. So we stress more on self-breast examination. If you see something, say something, because it's only through that the cancer can be detected early. Again, early detection is the key to survival. We also encourage the women to educate their daughters because these are women who these are girls who are going to become women in the future. Yeah. And also, here in the US, when we go out for community outreach, we encourage women to have their mammogram. Mammogram is very effective in detecting cancer early for women who are 40 and above, and for women who are below 40, we encourage them to see their doctor for a clinical breast examination.
So before we end, what is lacking in the message? Because it seems like there is more and more awareness, but some women are still not aware of early detection, self-breast exam, and other steps. What is lacking in the message, and what is your message?
Well, here in the U.S., there are a lot of barriers, that are faced, people in our community, that's the African immigrant community, face when it comes to the cancer care continuum, that is from outreach all the way to survivorship. So we are talking about immigration status, we are talking about a woman not understanding health literacy. Do they understand what cancer is? Do they understand that it's a disease that affects both men and women? So all these factors contribute, to why you see that there is a delay, or even when the message is out there, women are still resistant. But our organization, we are very strong on advocating. Yeah. We have been able to establish partnerships here in the U.S. to refer women without health insurance for early detection screening.
Okay, Ms. Dasi, thank you so much for joining us today.
Thank you for having me.
And that was Sylvia Dasi. She's Executive Assistant, Research Associate, and Community Outreach Specialist of the African Women's Cancer Awareness Association. That's our Africa Health Report for today. Vincent?
Well, thanks a lot, Linord. Be sure to watch Linord Moudou's Health Report every Tuesday and Thursday right here on Africa 54.